more major systems, one of the things we're going to do is always try and tie it back to medical. So usually toward the end of a unit when we're almost done with notes, I will always have some information about different medical conditions that are common to that system. So we're going to be looking at skin conditions today. These are the more common ones. I mean, obviously we can't cover everything that's out there, but these are the more common ones that if you do go on to become doctors and nurses, these are some of the things you're probably going to see. A lot of this is in Google Classroom, so again, pay attention to where the stars are, and that will, because it's a lot of information, so you don't have to write every single thing down because you've already got this. So a couple different infections and allergies. Athlete's foot, which most of us have at least heard about. It's pretty common. It's caused by a fungus that infects the layers of the skin, and this fungus can be transmitted in like wet, moist conditions. So this is why it's common at like gyms or locker rooms where people might take a shower or walk around with barefoot or things like that. It's common at colleges where they have a communal bathroom. So it causes like itchiness and redness and peeling usually around the toes or between the toes. But there is an over-the-counter topical like cream that you can put on it that treats it pretty well. The main thing is to keep your feet dry, and in college if you're sharing a bathroom with other people, to wear like sandals or flip-flops in the bathroom. Boils and carbuncles. Boils are also called furuncles. These are caused by inflammation of the hair follicles. So we learned the different parts of the hair. These inflammations cause swelling and redness and tenderness, and sometimes they'll also, well, oftentimes they cause like pus to build up. The pus is basically white blood cells that are accumulating in the area trying to fight the infection, and sometimes they just accumulate too much and kind of increase the swelling. So they are some kind of hair irritation and often associated with one of the hairs. Now cold sores are a little bit different. Cold sores are actually a virus. Now this is not like a canker sore that you get like inside your lip that from eating like too much acid and sugar and things. A cold sore is usually around the outside of the lip, and it gets kind of scabbed over and it gets kind of sore. It's actually caused by the human herpes virus. So if you get a cold sore, you basically have herpes. It causes blisters and itching and stinging. And because it is a virus, it can be transmitted. So it can get transmitted from one individual to another. But there is cold sore medicine that is also over the counter that you can get to treat that. So here are some examples of pictures of what they would look like. So athlete's foot is kind of flakiness, usually around the toes. And again, it's due to a fungus. If you think about the way the skin is layered, it would make sense that a fungus may like the skin because the outermost portion of the skin is dead. So it's a great place for a fungus to live. And then between the toes, when our feet are in our shoes and our socks, it's a wet, kind of moist environment sometimes, so it's a great place for a fungus. Now, the other pictures are showing the furuncles and the carbuncles, and you can see how it's an inflammation of the hair follicles. This is what it would look like if you're looking down on it. Basically, it looks like a really large pimple, but the swelling typically will go more deeper into the skin than a pimple, which is more superficial. Sometimes it leaks to the lower levels and then it doesn't come to the surface. In that case, it's really sore and red, but that's because the infection is located deeper. All right, other types of issues, and again, all of these are in Google Classroom for you. Contact dermatitis, caused by exposure to chemicals that provoke an allergic reaction. So this is kind of like if you change the laundry detergent and you suddenly break out from the laundry detergent. It's causing you irritation. Something like that. If you use the lotion and instead of making your skin smoother like it's supposed to, it makes your skin red and irritated. So that's what contact dermatitis would be. It's kind of a reaction to something you've applied to yourself, and sometimes it takes a little experimenting what it is, whether it was a new type of fabric or whether it was a detergent or a dry
I've actually had that on my lips about 100 million times.
Really?
Yep.
Is it not? I'm sure it's not.
Oh, it's absolutely terrible. Like
Yeah.
the worst thing you've ever had.
Yeah, I mean it's caused by a bacterial infection, so probably like antibiotics or something like that. And you guys know the difference between a bacteria and a virus, right? Did you cover that?
Not really.
Okay. We'll talk about that because it's really important. There's a lot of misconceptions about bacteria and viruses. Bacteria are like little bugs. They're not really bugs, but it's a way to think of it. Little tiny things that are foreign that are not supposed to be there that get into your body. If you have a bacterial infection, then antibiotics is what treats it. Antibacterial antibiotics. If you have a virus actually gets in and takes over your own cells. So it's not really a foreign little bug, it takes over your own cells and kind of infiltrates your own cells. A virus cannot be treated with antibiotics. Antibiotics does nothing for a virus. So that's why if you have a cold, you're like, some people are like, oh, just give me antibiotics. It's not going to work. Cold is a virus. It doesn't have anything to do with bacteria. Antibiotics only work for bacterial infections. Now, if you get strep, that's bacteria. So you need antibiotics for that. If you get an ear infection, that's bacteria. So you need antibiotics for that. And with antibiotics, it is important to take the full dosage because what happens is most dosages are for like 10 days. After about 3 or 4 days, you start to feel better and you're like, oh, it's okay, I don't need to take it anymore. Well, what has happened is the easy bacteria, the ones that are easy to kill, have died off. But you still have some of the stronger bacteria. So you have to make sure to take the antibiotic for the full time so all the bacteria gets killed. If you don't, it can create bacteria that is more resistant to antibiotics. So always take your antibiotics for the full amount of time. Otherwise, you can create like a super bug. All right, anyways, back on topic. Psoriasis. Psoriasis is triggered by trauma, infection, hormonal changes, stress. So there's a lot of things that trigger psoriasis. Red epidermal lesions covered with dry, kind of silvery scale-like. It's itchy, it burns, it cracks, and it sometimes bleeds. So it's different from impetigo. Impetigo is mostly around the mouth and the nose. Psoriasis can occur anywhere on the body. And a lot of times there's some kind of trigger that activates it. Alright, so here's what cold sores look like. This one's impetigo, and this is psoriasis. So psoriasis, again, is kind of more silvery and scaly. And impetigo is more kind of almost scabbing. Same with cold sores.
Was yours that bad, Kylie?
Kylie Jenner lips. She had Kylie Jenner lips.
That's not as gross as that, though. But it was bad.
Alright, now this one you do need to write down. Burns are common. Burns happen. I'm sure everybody in this room has been burned at some point.
Yes.
I have a 3rd degree one on my leg right here.
How'd you get that?
I was looking for my brother's phone because I lost it. I was looking on the dinosaur side by side, and I hit my leg against the buckler.
Yikes.
Yeah, I didn't know it was there. Did I hurt, girl?
Well, burns are quite severe, and well, it can be quite severe. They can be caused by lots of different things. Heat, electricity, UV radiation, and chemicals. Oftentimes it's going to result in self-death. And you've got to think of the issues that come with exposed underlying tissues. Your skin is there to prevent those underlying tissues from being exposed to the environment. If the underlying tissues like the hypodermis and the muscles and the connective tissues are suddenly exposed to the environment, huge increase in infection rate. Huge increase in dehydration because your body will be very leaky. You want to keep it covered with the epidermis because it keeps the fluid inside. Your body can go into shock because suddenly your temperature is not being regulated. Burn units are very serious places in the hospital because there is a lot that they have to take care of. Plus, it really, really, really hurts. Other things that can happen is the proteins can break down, dehydration, electrolyte balance, circulatory system shock, all of these things if the burn is severe or covers enough of the body. results in loss of body fluid, results in infection because your skin keeps out bacteria and suddenly the bacteria has easy access to the inside. So infections from burns is very common, especially the more severe burns.
Don't leave school. Don't leave school.
I never did that.
Yeah.
Oh, no, 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 no. You guys like my face? Yeah. That's all of it's fine. They don't really like saying that's on there. What'd you say?
Please don't tell me it's going to mess up again.
No.
It might. Sometimes, remember, it does that spazzing thing. So, okay, we're okay. Okay. All right. So if you are a doctor, if you work in an emergency room, or if you work in a burn ward, you're going to need to determine how much of the body is actually impacted by burns. And you can quickly estimate what percentage of the body is covered by burns by doing something called the rule of nines. The body is divided into 11 areas for quick estimation. Each area represents about 9% of the total body surface. So 9 times 11 is 99%. The area surrounding the genitals represents the last 1% of the body. So we're going to look at this in a moment and talk about how the body gets divided, because this will be a question on your test. You will have a picture. It's going to be a drawing. It's not an actual picture of a burned person. But you'll have a picture or a drawing of a patient that is covered with burns, and you're going to need to estimate how much of the body, what percentage of the body is covered in burns. On the test, I will do my estimation, and then you need to be either 5 points above or 5 points below. You have to be within that range in order to get points for it. So you don't have to hit my estimation exactly, but you have to be in the ballpark of it.
You wasn't? You wasn't? I'm never gonna somebody really under. On New Year's? New Year's? Yeah, that was actually
Okay, so here's how the body gets divided up into nines. So you gotta imagine that this is the front, but the same rules apply to the back. So we've got the front of the head is 4.5. The front of the arms, 4.5. So if you take the front and the back of the arms, the whole arm total is 9. Okay, so the whole head total is 9. The legs, because they're longer, you've got 9 on the front and 9 on the back. So an entire leg would be 18%. Okay, so an entire leg, 18%. And for the trunk, 18%. So on the back, also 18%. So using this, you can easily observe an individual and estimate, okay, about the front of their arm is burned, so that's 4.5%. Their face is burned, that's another 4.5%. So now we're at 9%. So you can quickly add it up and estimate how much of their body is burned. Is it completely accurate? No. But when you are in an emergency room, patients are coming in, and you have to make a quick judgment, this is an excellent way to make that kind of quick judgment. All right, so let's talk about the different kinds of burns, because this is another thing you'll have to determine for the test, is what kinds of burns are present. First degree burn. These are superficial, only the epidermis. This is like a sunburn, all right? A sunburn that's not too severe, it hurts. You're not blistering from it, but it's just on the surface epidermis layer. The skin gets red, it gets swollen, it hurts, but you're not gonna have any blistering or anything like that. Now, the second degree burn. This is going down deeper. The epidermis is completely burned, and you've got the top part of the dermis that's been damaged too. This will cause a blister. That's kind of the first way you can recognize that this is a second degree burn, is if there is a blister present. There are no blisters with first degrees. Second degree does have a blister. The skin is red and painful, and it does blister. During this, even though, remember that the epithelial is created at the stratum basal. So if the stratum basal gets completely destroyed, you cannot make more skin. At this stage, you can still have regrowth of skin, because yes, the epithelial and the stratum basal are damaged, but it's not to such a degree that it can't repair itself. So these two burns, while painful, your body can typically recover from. Especially if it's over just a small area, like you burnt your finger or something. I mean, most of us have done that at one point, burnt our finger and got a blister.
It's not. Why would you ask? No, but I can keep
I think it's the mealworms. I think the mealworms
No,
have
I
it in the
smell.
smell.
Where are the fans at? Up there?
In the cabinet.
I smell the cabinet. Oh my god. Is that it? Oh my god. Do you smell it? I don't have COVID, Emma. I can taste my
Why would I
Can you
smell
take
it?
a joke? I'm just kidding.
Okay, so third degree burns. This destroys the epidermis and the dermis. Now we have a very serious burn. Typically, the burned area is going to be painless for a while because you've destroyed the nerves. You've cauterized the nerves, so at first you're not going to feel much because it is so deep and it's so severe. This generally requires skin grafts because you've destroyed the stratum basal where the skin typically regenerates, so it can't build itself back up. Miss Ayers. Hi. Okay.
Cool. When did you start this?
Mm-hmm.
Let me see your company. Is it test drive? I think there was a book. No, no.
I don't know if we sent any pills with her. That's all it is. It's like a dairy enzyme thing. Yeah, that's what it is. Okay, yeah. Thank you. Sorry. Hi. Okay, sorry. All right, so third degree, you have destroyed the stratum basal, which is where the epithelial tissue is going to regenerate. So if you can't regenerate tissue, that's a problem. So the reason that skin grafts work is that it restores that stratum basal layer. It's putting it back from another source. The area is usually gray, white, or black because it is just so severe. Sometimes it's black and has a burned look because that's dead tissue. Sometimes it's such a clean burn that has a grayish white appearance because you kind of cauterize that whole area. If you are unlucky enough to get a 4th degree burn, these are kind of rare because mostly it's going to be like if a person gets electrocuted and electricity shoots out of them, it can cause a 4th degree burn. This is extending deeper so that even the bone, the muscles, and the tendons are exposed or destroyed. Very dry and leathery appearance because the damage is so severe. Typically does require surgery to repair the damage and may even require amputation in some cases. So again, this is like if a person was working on a power line and the power line shocked them, the electricity is going to go through their body and have an exit source. And usually that exit source that's trying to get back to the earth, that's going to cause the 4th degree burn. And we are going to look at pictures of these.
What time is it now? Like, why are we going to the jamboree? Who doesn't go to the jamboree? I don't know. What time does the jamboree start? Huh? What time is it? 6? What's the 5:30.
5:30.
Pay attention. Shut up, bro. It's not 5:30 or 6? 5:30.
How are you getting out?
What are you making?
Okay, so here is a graph of different kinds of burns. It is a little graphic. So 1st degree burn is superficial, and you can see there's a drawing and then there's an actual example. So we've got our epithelial layer that's damaged. So it is painful, it does turn red. Again, a sunburn is a great way to think of it. Most sunburns, unless they're severe, you're not going to blister or peel. It just hurts for a couple days and then you're usually okay. Now, if you do get a sunburn that blisters and peels, that's because you've gotten a 2nd degree burn. You've burned through the epithelial layer and you've gone down into the dermis. This is going to be much more painful because you have nerve endings exposed, and it is going to have a lot of peeling because you are trying to regenerate that tissue, but with 2nd degree burns, you can still regenerate the tissue. Now, when you get to the 3rd degree burns, you've burned through the epidermis and the dermis, and you're down into the hypodermis. So at this, it is very, very severe. So this patient has gotten burned all across the abdomen and down the arm, and it's more of a blackish color, sometimes kind of a yellowish grayish color, because the tissue has died. And so they're not going to be able to regenerate that tissue on their own. They're going to need skin grafts. The tissue has lost this layer here, the stratum basal, where regeneration takes place. Then this would be an example of a 4th degree burn. In this case, it was probably an individual who was working on like a power line. It's kind of graphic, but you can see the exposed tendons and the muscles here in the arm, and also the blackened parts of the hand. Most likely this hand would have to be amputated because it's damaged too severely. It probably isn't going to be able to be repaired. This is another example of the different kinds of burns. We've got healthy tissue here, but then we have our 1st degree burn where you can kind of see that it's the epidermis, and then we've got our 2nd degree with the blistering, where the epidermis has almost gone down to the dermis. By the time you get to 3rd degree, we are into the dermis, and then into the hypodermis. 4th degree, you're down into the lower lying tissues. All right, so other things, skin cancer. Skin cancer is the most common form The thing that impacts it the most is overexposure to UV sunlight radiation. If you're in the sun too much, you are much more likely to get skin cancer. Thankfully, tanning beds aren't as popular now as they used to be. Now the spray tans and things are getting a lot more realistic. So spray tanning is becoming more popular than actual tanning beds. And that's good because spray tanning is a lot safer. The thing with spray tanning is it does fade because it is just that surface epithelium, so it is eventually going to fade off. Now, cancer in general, and this is all cancers, can be categorized in two different ways. You've got benign or malignant. If you go to a doctor and they say something is benign, that's what you want to hear. Benign is okay. I mean, it still means you have a tumor, but it means that tumor is not cancerous. And that tumor can most likely safely be removed and has not spread. A tumor we've already talked about is called a neoplasm. So if you hear a doctor say neoplasm, that's referring to a tumor. Malignant is not what you want to hear. Malignant does mean the neoplasm has invaded other parts. It is cancerous. Now, cancer is basically mitosis gone crazy. It's a cell that is dividing over and over and over again without stopping. Usually, if something is wrong with the cell stops itself and will basically go into cell death and kill itself rather than make lots of more bad cells. But cancer is basically a cell that has gone crazy and divided over and over and over again. This is why cancer is so dangerous. If you leave one bad cell behind, the cancer is going to come back because that one bad cell already has the bad information in it, so it's just going to start the process all over again. This is why some people can go into remission after their cancer is removed, and then eventually the cancer comes back because a cell or two was missed. That's also why when people have cancer, they will usually have chemo or radiation treatment because they want to make sure they get all the cells. Radiation treatment is more directed, so it is more like targeted. If there's an area that had cancer, it can target that area. Chemo is more the whole body. So chemo, you're typically hooked up to an IV, and the IV delivers the chemo. The chemo goes into your whole body. Chemo targets cells that reproduce. This is why your hair falls out when you have chemo, because hair is constantly going through mitosis. So if it's targeting cells throughout the body that are going through mitosis, chemo is going to target hair cells too.
My grandma has had skin cancer on his face, but the thing is that it comes back on the same spot. Like, it's the same little patch on his nose all the time. So, like,
Does he have to get it removed over and over?
yeah.
And it's probably because they're not getting all of the cells when they
Tell your doctor to be better.
A lot of, like, my grandmother had cancer, but it wasn't the kind that spread to other parts of the body. So she had like facial reconstruction, and they got it all. She's been okay since then. But it was pretty severe. Like, they had to take quite a bit.
He's only really had like really small patches, and it always appeared on the same place, like right on his face.
Well, at least he knows what to look for.
Yeah.
All right, so we already talked about this. It's mitosis gone wild. The cells just divide and divide and divide, and they don't stop dividing, and they're supposed to stop dividing. One bad cell is going to make another bad cell, and then those two bad cells are going to make 4 bad cells, and then it gets really out of control. The most common types of skin cancer: basal cell carcinoma, squamous cell carcinoma, and malignant melanoma. So those are the 3 most common types you're going to see in the medical profession. Now, it's obviously not the only types, but they are the 3 most common. Malignant melanoma, that's the scary one. Melanoma is scary because we'll talk about it in a moment, but malignant melanoma can do something called metastasize. When it metastasizes, it goes into the bloodstream and it goes to different parts of the body. for my Grey's Anatomy fans,
Oh,
that's what
yes.
happened to, what was her name? The one that got skin cancer and kept seeing her dead boyfriend.
Lizzie.
Lizzie, yeah. She had malignant melanoma and it metastasized, and this cancer went to different parts of her body. And that's why she was affected in different ways.
That was the greatest stuff. His name was Daddy. Did you get to this?
No.
Oh, that was crazy. It was like probably one of those episodes. It's really good. She said a lot of different episodes. Because we're always here about she does.
Okay, so basal cell carcinoma is the least malignant and the most common. It arises from the stratum basal layer, and it has a shiny dome-shaped nodule. It develops a central ulcer over time, but it's kind of just like a shiny dome, and it's not super dangerous, but it is considered a type of cancer, and it's called basal cell because it comes from the stratum basal layer.
What do we have in this list?
After Thanksgiving. This is our last bit of notes, but we still have several other projects and assignments.
American cancer. Yeah, I couldn't do it.
Oh, God.
That she would burn.
Yeah, they were burning on me.
You will never catch me thinking about it too much.
Oh, no.
Yes. You will never catch me
Oh my God, I kinda like, what?
For what?
Exactly. Yes. It's like in this.
Do not say that word.
What she said?
She said moist. That's what she said.
No, because when it goes in there, it's going to be dry. Cooking. Could be some beef jerky. You started it. That's why I didn't take my
Hey, Mom.
I'm getting a call from Columbia. It may be about my son's past, so I'm gonna step outside and take it really quick. Hello?
You can put it sideways, yeah.
And like it was literally red.
Yeah, kind of.
This has been my night to cross
Have
the
you ever gone to
water.
that? Well, that's fine. Say, did I say this? That's what that was. Kylie, can you do this one little one of those?
What is the last one? Symptoms or?
I'm just gonna do that with a Sharpie probably. And then I'll make like a white piece of paper.
Okay, hold that thought.
Make space.
That was about my son's cast, and they're gonna call me back because they kept cutting out. There he goes.
You have one.
Bye, Felicia. Are you
What shoes are those?
Doran. I want the pink. I think these are. Have you seen the pair that's like it's like pink and peach?
I would like that.
Okay.
Miss Ayers, you want to see what my burn looks like?
Yes, I want to see your burn.
I didn't feel it after it happened. It like.
Oh my goodness, yeah, you can see the tissue underneath.
This was my nickname I had erythritizome.
And this hurricane stuff, and Mom was like, "I'll put it over." And it burned. Because like I had like a cooling thing,
Uh-huh.
and it burned so bad.
Did it leave a scar?
Yeah, I
Did
think
you have to do a skin graft?
No, I put a band. It was like so. His mom gave me these like gauze, giant gauze pads, and I just like took it cover and like put this it's a kind of like cream medication. So you can put on.
Well, I didn't need a.
Yeah.
And it didn't get infected. Okay, moving on. This is what the basal cell carcinoma looks like. So it's kind of a raised, kind of shiny. You see these more often in like elderly people because this is a cancer that is not super dangerous. So sometimes they don't even treat it. They may watch it and keep an eye on it, but they don't necessarily treat it all the time. All right, so squamous cell carcinoma, the stratum spinosum layer is where this is going to take place. And this one is due to UV exposure. Scaly red papules, sometimes they're going to form like shallow ulcers. And these can metastasize into the lymph nodes if they are not removed. If you remove them early enough, that's good. But if you leave them for too long unchecked, without getting them removed, that's when they metastasize. And again, metastasize is what you do not want to hear. Absolutely not. Because that means it has gotten out of its location, and it has gotten into the blood, and it has traveled somewhere else. So now you don't have to just worry about skin cancer. Now you have to worry about skin cancer and pancreatic cancer. Or now you have to worry about skin cancer and lung cancer. Because that cancer has traveled from your blood to another part of the body. So metastasizing is super dangerous and super scary because you never know where it's going to end up. It can end up in many different parts of the body. Maybe it's just one part, maybe it's multiple parts. I'll come back to this in a moment. I just want to see how many slides we have left. Okay, we're getting kind of close. Kind of close. Okay. There we go. Well, there's a lot of skin conditions. What can I say?
It's not fitting.
There's a lot of things that can happen.
Cutting off the bone.
Okay, so this is what squamous cell carcinoma looks like. You can see that it's definitely different from the basal cell carcinoma. It does have more of a kind of a like enlarged mole appearance. A lot of times these are going to be located in places that people don't typically look. So like the ear or the back or the neck or something like that. Places that you don't normally look to find cancers. Malignant melanoma is, of course, the most deadly, but it's also the most rare. It only accounts for about 5% of skin cancers overall. It arises from the melanocytes, which is how it gets its name melanoma, and it metastasizes very rapidly. So that's why if you get malignant melanoma, you need to get it taken care bloodstream and the lymph nodes pass. And so it's important to get this taken care of as soon as you notice it. There is a rule for detecting ABCDE, which we will go over in just a moment, that helps you to determine, okay, well, this mole looks suspicious. What should I be concerned about it, or is it just a typical mole? So this ABCDE rule kind of helps you narrow down if it's a concern or if it's not. And unfortunately, people who have more moles are more likely to get this. They have more melanocytes being produced in those areas. That's what causes moles to appear, is melanocytes. And so they are more likely to get malignant melanoma. So that's why it's important to be like aware of your body. And if there is like a large mole or something, to just kind of pay attention to it and make sure that it's not like changing shape or anything.
My birthmark gets on a mole. Where's your birthmark?
Okay, so this is in Google Classroom. This will be a question on the test. But it is in Google Classroom, so you don't have to write it down. The ABCDE helps you determine if a mole is melanoma or not. Asymmetry. The mole should be symmetrical, like a circle. It shouldn't have one side bigger than another. It also shouldn't have jagged borders, border irregularity. The borders should be nice and smooth, not jagged borders. The colors should be the same throughout. If the mole is two different colors, then that's a time to be concerned. The diameter should be small. If the mole gets really large, again, that's a time to be concerned. And evolution means that it's going to change over time. If any of those other characteristics, if the color changes, if the border becomes irregular, any of that, then that's an indication that it could be melanoma. So here's an example of what melanoma looks like. You can see it's large, it's dark symmetrical, it's not like a nice circle. It's got like little indents here, so the border's not regular either. So that would be an example of melanoma. And here's kind of a chart to help you compare like normal moles to not normal. So this top row is all normal, and this bottom row is all not normal. And this is also in Google Classroom. So this one's symmetrical and nice and circular. This one's got all over the place. This one has a smooth border. This one has an irregular border. This one is one color throughout. This one is two colors. This one is smaller and this one is quite large. And then this shows that it has changed over time. So that's an indication as well. All right, this is in Google Classroom, so you don't have to write this down. I know we're getting kind of close to the bell. I think, yes, we can do it. We can do it. Lanugo is a downy covering that covers the baby when the baby is in the womb. And it will disappear usually by birth. But sometimes babies are born and they look kind of fuzzy. And that's what Lanugo is. Vernix cassiosa, this is very common. It's kind of like a cheesy kind of stuff that covers the baby at birth. Many babies, if you've seen newborns, they're covered with this waxy, cheesy stuff. That helps protect their skin from getting dried out when they're in the womb. Milia are small white spots, also common in babies. Not quite pimples, and you're not even supposed to pick at them, but you'll see it kind of, they look like little tiny pimples. And acne, of course, is another skin condition that I'm sure we are all very familiar with. Other other things, you don't have to write this down. In youth, the skin is thick and resilient and well hydrated. As you age, the skin gets thinner, it loses its stretchiness, it becomes more papery. Skin cancer is a major threat to exposed skin to excessive sunlight. So people who are out in the sun a lot have a higher risk of skin cancer. Balding and or graying occurs with age. Both are usually genetically determined, but there are some things like drug and emotional stress that can cause it as well. Okay, we finished. That's all. Sorry, that was a lot of notes. We got sidetracked and the phone call didn't happen.
I said I will make up my mind.
Tomorrow will be a work day to work on our to work on the tissue boxes. So tomorrow is a work day to get those finished.